any of the changes you have done? I'll start with Shokri this time, Mayroz, because let's take him when he's hot and talking about AXA 1, and he gets the biggest smile on his face, which is amazing. Any changes that we have done, would it continue moving forward?
I think yes. It's when we launched, we were very conscious on a lot of training regarding relationnel with clients, regarding hygiene, regarding certain standards. And I think with what happened, it made our life easier to this approach with the clients, with the staff we are hiring and joining within the trainings, even if now the trainings are online. But it made it easier. And I think this consciousness of perfectionism a little bit more than the normal practice of healthcare services is gonna increase everywhere now. To take care of the steps you're making, following the protocols, following the guidelines, much more in a more convinced way than rather simply doing it to do it. And I think it's not only for our team, but around the country and around the globe, this became a better approach. Things that will stay is that the clients are more conscious of their health, and I'm talking clients because we always talk to them about customer clients, not about patients, because we don't only treat sick people. We try to fully have the journey with any customer regarding their health when they are well, when they are sick, and when they are after they get sick. So the consciousness about the health education and being healthier and protective of doing things that will harm your health is better. So it makes also our life easier in terms of the introduction of the new approaches all of us here around the table are trying to make in the primary care sector and the secondary care sector as a change. Moving to the third part, which is digital health, and I think digital health is the future by any means. But we have a strong belief, and I think we still have the strong belief that it cannot happen alone. It needs to happen between online and offline. So to have what people are used to, the medical center or the clinics like in Dewi that support the clients, but also support them everywhere and support them digitally. And also what happened with COVID-19 accelerated the acceptance of such approach. Yes, we have been very lucky that we have our insurance sister company in Egypt that through our service has been dealing on teleconsultation for a while. It's a plus, it's an advantage. But now even we are seeing this in the non-insured population we are serving, that they are starting to be gaining the trust toward a teleconsultation, a video consultation. Yes, we do it when we are squeezed, but we are not used to do it when we are at ease. And they are seeing the benefits where you don't have waiting time, you have access to the doctor directly, you can explain what you want. And definitely it has its limitation. So that's why the complementarity between the physical clinics and the digital health future is there, but it has been accelerated, and I think this is a chance for this future of primary care that we are all trying to make.
Great. So I guess two great points right there. I got let's end sick care and start real healthcare, and the other one is digital health can be performed in a hybrid way. So Mayroz, what's your take? What are you taking with you post-COVID? What did you pack in your post-COVID bag?
We've definitely learned some clinical, more. I'll take an example, infection control audit measures. So we've learned more measures because of the situation we're in now. And this is something that we want to keep on doing. It's a new skill, it's a new process that we've learned inside the clinic. And something like that is very useful to take on to the future. It's not just limited to COVID time. One of the things that we did was move our call center to a work from home situation, which was very challenging, but we were able to do it successfully. And this has opened up new employment models, more flexible contracts with people. This is something we'd also like to maintain. I think one of the things that I'm very happy that happened is that there's a newfound appreciation of our electronic medical records. So since day one, we've been using electronic medical records for all our clients, and having to move to part of the service being remote on telehealth. The whole team now appreciates the fact that we have backgrounds of patients that are calling with symptoms, that we're able to check what kind of medication they're on. And I think this is one of the things that we gained as an organization, an appreciation of going digital from day one and maintaining it across all the different branches. Khalid, we were speaking about clinic reviews and meeting with doctors online. That's one of the other things that I think will definitely be taking forwards. I'm one of these people who likes personal meetings and is negatively affected by this social and physical distancing, but it has proven to be a very efficient means of reaching the whole team. We have a team of 120 doctors right now, reaching them all, bringing them all in at the same time, cross-checking, not at the same time, I mean, but having different meetings, having them all attend was very, very challenging. And during this phase, we've moved to online meetings, and that has given us a lot more attendance with the doctors, a lot more, so they've given a lot of input on what was going on. And as you said, Khalid, it was a good chance to connect with the whole team and build a very warm connection with everyone. So taking that with me.
Indeed. So definitely people working from home opened a lot of possibilities to people that couldn't work, and emptied actually more space for people that need to be client facing or patient facing. Electronic medical records are paramount, definitely. And those virtual meetings, although they were amazing in the very early DC period during COVID, but now it's so common when you ask people for a meeting, they tell you, sorry, I have a Zoom meeting. It's a little bit funny that even now people are virtually busy, which is a new term that we're seeing.